Swayam Prabha. Digital India. Educated India.
Welcome to today's session of Course Therapeutic Nutrition. This is the second module, that is etiology, clinical features and nutritional management of infections and fevers. This is the last lecture of this module, and in this lecture we shall be studying about nutritional management of HIV-AIDS infection. I am Dr. Jaspreet Kaur, presently working as Assistant Professor in Government College for Girls, Ludhiana, Punjab, affiliated to Punjab University, Chandigarh. And this project is funded by DTH Swayam Prabha, MHRD, New Delhi. In this module, we have studied about infections and fevers, and then we studied about the relationship of nutritional status with the infection and key nutrients which are important during infections. And then we studied about fevers, in which we saw what is the effect of fever on the nutritional status, and then we studied about various types of fevers and principle of diet therapy during typhoid and tuberculosis. Now, let us study about yet another type of illness that is caused by HIV infection, and we will be studying about etiology, clinical features and nutritional management of HIV and AIDS infection. HIV infection is an example of chronic infections. Its existence was discovered in 1981. This disease poses a major public health threat, as it is not only impacting the health of the people, but it is also hampering the social as well as economic development. It has been shown to be caused by retrovirus, which is one of the most dreaded infections. Let us see the prevalence of HIV-AIDS infection. HIV has claimed almost 33 million lives so far, and according to World Health Organization, there are 38 million people living with HIV, and in 2019 data that shows that out of these 1.7 million people, they are newly infected, and 0.7 million people, they have died because of HIV infection. However, with increasing access to the effective HIV prevention, diagnosis, treatment and care, including the care of opportunistic infections, HIV infection, it has become a manageable chronic health condition, thus enabling people living with HIV to lead a long and healthy life. Now, let us study about this infection. Human body is a superb machine, and it adapts itself to all the conditions. It is strong enough to fight all the external enemies trying to harm it in any way. Human body is equipped with an army of soldiers to protect it from any invading pathogen which is capable of causing harm. And these soldiers, they chase, fight out and kill any external invaders. This army of soldiers is called immunity, which is comprised of many types of general and specialized fighter cells. We call them immune cells. Therefore, the strength of these immune cells is key to good health and protects us from various types of diseases. In fact, we have already discussed about the interaction of immunity and infection in the previous lectures. What if the strength of our fighter cells is decreased? What if the number is decreased? What if the invading pathogens overpower our immune cell? All these situations, they affect the strength of our body, where our body's immunity goes on and it ultimately gives in and we fall sick. HIV infection is such condition in which our immune cells, they are targeted, overpowered by the invading virus, which leads to collapse of immune system, and this leads to extreme health deterioration, and it exposes the body to many opportunistic infections, and many of these infections can be fatal also. So let us study about the virus attacking our immune system and causing AIDS, that is acquired immunodeficiency syndrome. HIV, or human immunodeficiency virus, is a retrovirus which is roughly spherical with a diameter of around 120 nanometer. It is 60 times smaller than our red blood corpuscles that attacks and impairs the body's natural defense system, which fights against diseases and infections. There are two types of this virus, that is HIV-1 and HIV-2. Out of these, HIV-1 is most active and aggressive, and we see the patients infected by this virus only, causing global epidemic, whereas the HIV-2 is restricted to West Africa. HIV infects a type of white blood corpuscles in our body's immune system. We call them T helper cell. We also call them CD4 cells. These are a type of lymphocytes which help to coordinate the immune system by stimulating other immune cells such as macrophages, B lymphocytes, CD8 lymphocytes. They all together help in fighting the infection. Now, HIV, it will weaken our immune system by destroying our CD4 cells. HIV cannot reproduce on its own. Instead, the virus attaches itself to the T helper cell and it will fuse with it. It will then take control of the cell's DNA and it will make copies of itself inside the nucleus of the host. And then it will multiply and spread throughout the body, and we call this process as HIV life cycle. And in this way, HIV will weaken the body's natural defenses and over time severely damages the immune system. So, progressive depletion of CD4 cells, this will lead to immunodeficiency. Ultimately, this disease involves the entire body and it will cause a lot of symptoms. There could be constitutional diseases, neurological complications, opportunistic infections, and neoplasm. Neoplasm is a new or abnormal growth of the tissue in the part of the body, especially which is a characteristic of a cancer. So who are at risk of getting this infection? People who are having unprotected sexual contacts, or those who are having some sexually transmitted infection. Then people who are sharing contaminated needles or syringes or other injecting equipment or drug solutions whenever they are injecting drugs, or people who are receiving unsafe injections or who have undergone some kind of blood transfusions and tissue transplantation, and there are some medical procedures that involve unsterilized cutting or piercing instruments, And then those who are experiencing some accidental needle prick injuries. This includes some health workers also. Now let us see how the disease transmits. It transmits through high risk body fluids, through contaminated instruments, or from mother to child. Now let us discuss all these methods of transmission. Through the body fluid, this virus can be transmitted via any of these high risk body fluid. They are blood, semen, preseminal fluid, vaginal fluid, and breast milk. Saliva, tears, urine, they do not contain enough virus. So the most common way of HIV is transmitted via blood and semen. Transmission can occur by sharing infected articles or instruments, such as in blood transfusion or skin piercing instruments, then sharing needles and syringes in case of drug addicts, then poorly maintained healthcare settings also, they can transmit this infection from one person to another. Then third way of transmission occurs from mother to child or fetus or infant. First of all, it can be transferred during the pregnancy or during the childbirth, and finally by the breastfeeding. So let us see what are the stages, signs and symptoms of the HIV infection. There are 4 stages of HIV infection. The first stage is known as acute HIV infection. This period is of around 4 to 7 weeks after the primary infection, and during this period there is a very rapid viral replication. People, they will have large amount of HIV in their blood, and they are very contagious in this stage. Some people, they will have flu-like symptoms. This is the body's natural response to the infection. But some people may not feel sick right away at all. And let us see what are the acute symptoms during this stage. So these symptoms can be systemic, such as the patient might feel that he has fever, he has undergone some weight loss, then some central problems such as malaise, headache, neuropathy can occur, then pharyngitis is another acute symptom. It can occur, and there could be sores in the mouth, there could be thrush infection which can occur, and there could be sore in the esophageal region also. Then myalgia can occur, that is muscle pain or weakness. Then liver or spleen can be enlarged. Then lymphoadenopathy, that is swollen, firm and sometimes tender lymph nodes that can occur. Then influenza or cancer of lymph nodes, they can occur. There could be skin rashes and gastric symptoms such as nausea, vomiting, that can also appear. This stage is followed by second stage, that is known as asymptomatic stage. Now let us see what is this asymptomatic stage. This stage is also called asymptomatic HIV infection or clinical latency stage. HIV is still active, but it will reproduce at a very low level. The people may not have any symptom or they will not get sick during this phase. Without taking HIV medicine, this period may last for a decade or longer, but some may progress little faster also. People, they can transmit HIV in this phase. The effects on the nutritional status, they will include some abnormal metabolism can be felt. Change of body composition will occur. That means the body cell mass loss could be there, which could not be visible on the weighing scale. There could be lipohypertrophy or lipoatrophy. There could be vitamin B12 deficiency, or there could be more susceptibility to the pathogens. At the end of this phase, the amount of HIV in the blood, we call it viral load, that will go up, and CD4 cell that will start coming down. The person may have symptoms such as viral fever that will increase in the body as the person moves towards the nearing the phase 3. The people who take HIV medicine as prescribed, they may never progress and they may never move to the stage 3. Now let us see what this stage 3 is. Stage 3 is also called symptomatic HIV. In this, the AIDS defining symptoms will start appearing, such as fever, sweating, skin problems, and fatigue may be seen. And decline in the nutritional status and the body composition may also occur. Here, the patient may see weight loss, loss of lean body mass that can also occur. Lean body masses are protein part of body. And then diarrhea, herpes zoster, that is another kind of viral infection, and peripheral neuropathy, that is related to the sensation through our neurons, and then inflammatory diseases such as related to the lymph glands that can occur, then thrush infection and other associated infections related to the poor nutritional status and lower immunity can be felt in this third stage. Now, some percent of people, they will eventually progress to the stage 4. That is the last stage of HIV infection. Now, let us see what is this crucial last phase of HIV infection. So, the most severe phase of HIV infection is stage 4, that is also known as AIDS, that is acquired immunodeficiency syndrome. And people with AIDS, they have such badly damaged immune system that they will get an increasing number of severe illnesses. We call them opportunistic infections. Now, people, they will receive an AIDS diagnosis when their CD4 cell count drops below 200 cells per millimeter, or if they develop some kind of opportunistic infections. Now, people with AIDS, they can have a high viral load and they can be really very infectious. Without treatment, people with AIDS, they will typically survive for around 3 years. There is a clinical staging system also given by World Health Organization, and it is for adolescents and adults where we use the clinical parameters such as signs and symptoms and opportunistic infections who are associated with the conditions. This staging is helpful where CD4 testing system is not readily available. So let us see what is this system. Here the clinical stage 1 is asymptomatic or generalized swelling of lymph nodes are there. In the clinical stage 2, where there has been unexplained weight loss, which is less than 10% of usual body weight, with minor mucocutaneous manifestation and reoccurring some upper respiratory tract infections. So this is a milder form. And then third stage is when the weight loss is more than 10% of the body weight with the unexplained chronic diarrhea, unexplained persistent fever, or oral candidiasis, that is fungal infection, then severe bacterial infections, pulmonary TB, and then acute necrotizing inflammation in the mouth, or some people at this stage will have AIDS also. So the last stage is clinical stage 4, where the opportunistic infections or cancer related to HIV they can be felt, and this stage uh, pertains to all the people who are having fully established AIDS. Let's see what are the common nutritional problems of HIV patients. There are some problems related with the nutrition. For example, there will be nutritional deficiencies which will be a result of anorexia, peptic ulcers, or infections in the gastrointestinal tract, zinc deficiency, or pancreatic disease, encephalopathy, etc. And then second reason could be because of gastrointestinal malabsorption, which could be due to some mucosal disease or because of some infections, inflammation, or fat malabsorption. Then there could be increased requirements. Once we know there is malabsorption, there is protein wastage, there is hypermetabolism, all these things, they enhance the nutrient requirements of the person. And then lastly, there are psychosocial factors such as poverty, illness, and limited access to the healthcare system. All these factors, they contribute towards the nutritional deficiencies. Malnutrition is important and complicated consequence of this disease. Now, PEM, that is protein energy malnutrition, is frequently seen as one of the complications. During asymptomatic phase, there could be mild weight loss along with fat depletion and malabsorption. This is because of all type of macronutrient deficiencies. Along with macronutrient deficiency, there could be some micronutrient deficiencies which could be seen in the infected persons, such as vitamin A, then zinc deficiency, iron deficiency, and then vitamin D, vitamin E, vitamin B12, and there could be antioxidant depletion. All these increase the requirements of the already depleted person. As we know, nutritional status and HIV, they are cyclically related. And this relationship is complex, which will depend upon the existing nutritional status, if there is any wasting or obesity present, or what are the micronutrient deficiencies, and what is the stage of HIV disease, then presence of any comorbid conditions along with the infection, and then some adverse effect of therapeutics is also to be accounted. And now let us see what are the goals of nutrition care and support for people living with HIV and AIDS. This takes us to the objectives of medical nutrition therapy of these HIV patients. They are to go for routine screening and to identify which patient needs better care and what are the common problems associated with the HIV, particularly to that person. And then secondly, preparing tailored nutritional plan to optimize the nutritional status and immune status of the patient. And then thirdly, to provide the nutrition support for common problems with HIV, which is an important objective. And then developing strategies to prevent losses of all the nutrients, including lean body mass. Another objective is adapting the dietary recommendations to avoid comorbid conditions and treat the complications such as diabetes, cardiovascular diseases. And then patient education is needed for diet modification so that the effectiveness of medical treatment is ensured. And then screening and developing interventions for growth problems in children, it is an important objective. And then along with that, tailoring the nutritional recommendations to fit the person's lifestyle and financial resources they They are very important objectives. And then lastly, the individual counseling of the patient to promote the nutrition self-care by using the available resources. Now let us see what are the important components of medical nutrition therapy to meet the objectives which we have just stated. They are nutrition screening, nutrition referral, nutrition assessment, and then finally calculation of nutritional requirements and modifications according to these requirements. So how do we go about the nutritional assessment? For asymptomatic patients, it has to be conducted at least 1 to 2 times in a year, and with symptoms or with AIDS diagnosis, that is stage 3 and stage 4, 2 to 6 times a year may be needed. And then whenever we are initiating or changing the antiretroviral therapy, we need to go for nutritional assessment as a guide. So for nutritional assessment, as we have already studied about the nutritional assessment, we go for anthropometric evaluation, biochemical assessment, clinical assessment, and then dietary recall. And these nutritional requirements for energy, the requirements, they are increased because of increased metabolism, immune response, and poor absorption. So we go for 10% increase in asymptomatic HIV adults, and then 20 to 30% of energy has to be increased in the symptomatic adults because their requirements they have raised further, and 50 to 100% energy requirements are to be increased in those who are experiencing extreme weight loss. And then average, if we talk about the calories, that is 30 to 45 kilocalorie per kg body weight. That is the recommendation for the energy. In HIV patients, deficiency of protein stores and abnormal protein metabolism occur. But unless there is specified conditions, normal protein should be taken. Then we can go for 1 to 1.4 gram per kg for the maintenance dose, and if we wish to go for repletion of the lost protein mass, then high protein can be considered, that is in the range of 1.5 to 2 gram of protein per kg body weight. This level has to be adjusted for some conditions such as in hepatic patients or in certain renal or pancreatic conditions. The protein can be achieved with the help of legumes, milk and milk products, nuts, and then animal foods they can be given, and a combination of cereal and pulse can be given so that the protein quality is enhanced. Now talking about fat requirement, there is the absorption is low, and fat oxidation that increases with the HIV infection. Therefore, dietary fat requirements they differ according to the case to case. It varies. Therefore, some researchers they suggest that increasing the intake of omega-3 fatty acids in individual with HIV who have elevated serum triglycerides may be beneficial. So, giving ample amount of MCTs and then M3 level ratio, they can be really helpful for these patients. Requirements of fluid can be met by taking 30 to 35 milliliter per kg body weight, and addition allowance has to be kept if there are any losses, along with electrolytes such as sodium, potassium chloride, which could be lost because of vomiting or diarrhea or any associated illness. And then coming to vitamin and mineral, since these deficiencies they are very common in the patients, so we have to see that ample amount of vitamin beta carotene, vitamin E, vitamin C, B6, B12, folic acid is given along with good amount of selenium. Then immunonutrients they can be given along with antioxidants, and here role of probiotics is also considered to be beneficial for slowing the progression of AIDS. So, an important aspect of nutrition intervention is to provide balanced, healthy diet by using locally available food or using some fortified foods or providing micronutrient supplements in some patients if they are unable to take sufficient amount of food orally. There are certain conditions which have a negative impact on the nutritional status. Let us discuss these problems and remedies to ensure that the optimum nutrition intake is restored. For example, in case the patient is complaining of mouth pain or sores, then the food can be served at moderate temperature, then mild foods they can be chosen, then spices can be limited, and soft hand foods they can be recommended which are easy to swallow. And in case the patient is having swallowing difficulties, then we have to avoid the irritating coarse and sticky foods, and straw can be used to ease out the swallowing difficulties. If the patient is anorexic, we can consider small frequent meals, and then his favorite foods can be recommended, energy dense food can be given, and then we can think about giving some multivitamin support along with, and then we have to avoid strong smelling foods for such patients. For nausea and vomiting, small portions can be considered along with the frequent meals, and then fluid should be limited with the meals. Then limited salt can be given. ORS is very handy in these conditions, and rest can be taken between the meal so that nausea and vomiting that is subside. And we have to ensure that patient is not empty stomach for a longer period of time, and he should not lie down immediately after eating. And then if there is change or loss of taste, we recommend flavor enhancers. We tell the patient to chew his food well, and he can take some good smelling food. If the person has constipation, fiber can be increased in his diet, fluid can be increased, and patient should be encouraged to do exercise so that the tone of intestine is restored. And the patient should avoid processed and refined foods. In case of diarrhea, plenty of fluid are to be encouraged, and he should be encouraged to eat during the illness and after the illness also. ORS is really good substitute so that it can replenish the electrolytes. And then banana and potato, they are easy to eat. And then soluble fiber foods, they are to be encouraged. And we have to check whether the person has lactose intolerance, and then what fried food, fats, fatty food, they are to be avoided in such condition. And alcohol is a big no-no. And in case the patient develops fever, then plenty of fluids, energy and nutrient dense foods, they can be considered along with strong, small, frequent meals. So let's summarize. HIV is human immunodeficiency virus. It is a retrovirus that attacks and impairs the body's natural defense system against the diseases and infections. It infects a type of white blood cells in the body's immune system that is called T helper cell or CD4 cell. The transmission occurs through high-risk body fluids, through contaminated articles, or from mother to child. There are 4 stages of this disease, that is acute, asymptomatic, symptomatic, and final stage, that is acquired immunodeficiency syndrome. There are a lot of metabolic changes which affect the nutritional status of a person, and the medical nutrition therapy involves routine screening, preparing tailored nutritional plan, nutrition support for the common problems associated with HIV infection, and developing strategies to prevent the losses from the body. And then prompt treatment of opportunistic infections is to be ensured, along with encouraging physical activity. And lastly, a due importance should be given to understanding the drug food interaction, and then understanding what are the side effects of the therapy, and nutritional management has to be done accordingly, and the patient should be counseled so that he remains positive and he is able to live in a better way. The 1st December is celebrated as World AIDS Day. Thank you.